Berkshire County was one of the first areas of the state to pursue a regional collaborative model to vaccinate their residents. These collaborations, as you know, pool resources from local healthcare providers and health departments to create highly efficient operations that can vaccinate residents across a wide geographic area. That's especially important here in the Berkshires, and the incredible work this team has done has paid off. As of last Thursday, Berkshire County reported, it's actually Berkshire and Barnstable County, those two regional collaboratives, the bookends here in Massachusetts, have reported the highest rates of the percentage of population that have received a first dose. Yours is currently at about 45%. I expect at some point in the not too distant future you'll cross 50. That number will continue to climb now that everybody's eligible, and especially if we can get more doses from the feds. Statewide, regional collaboratives and local health departments account for well over 500,000 doses that have been administered here, and they're in the top 5 types of providers by total doses administered. We've worked closely with the regional collaboratives to make it easier for residents to book appointments online, and this week we're adding 3 new collaborative locations on the Cape to the pre-registration system. We'll continue to maximize our vaccine distribution infrastructure to administer doses quickly, and regional collaboratives will continue to play a critical and important role in this process. Now, before I turn it over to Mayor Tyre, I just want to make one additional announcement about our ongoing public awareness campaign, Trust the Facts, Get the Vax. We launched this $5 million public awareness campaign back in early February to address vaccine safety and hesitancy, and since then, we've augmented that effort with a $30 million vaccine equity initiative, which has been focused on breaking down barriers to getting vaccinations and promoting access and awareness, especially in our disproportionately affected communities. Federal data shows that these efforts are supporting vaccine administration and that a vast majority of the people in the Commonwealth are interested in getting vaccinated. Recently published data from the CDC shows that Massachusetts has the lowest vaccine hesitancy rate in the nation, with all of our counties showing hesitancy rates that are well below 10%. People in Massachusetts are eager to get vaccinated. And in addition to our strong vaccine distribution infrastructure, this enthusiasm is a critical part of making Massachusetts the leading state among all big states in getting our residents vaccinated. Still, we know that not every community is equal, and that we still have a lot of work to do in communities of color, which have borne the brunt of this pandemic in many ways. That's why we've been doubling down on our efforts to ensure people are informed about vaccine safety and efficacy, and to come up with strategies, literally door knocks, pickups, mobile sites, and a variety of other approaches to help them get vaccinated. This week, we're also launching a new round of multilingual TV ads to remind people that the vaccine saves lives, and it is the best way to protect yourselves, your loved ones, your coworkers, and your neighbors. The continuing public awareness campaign will complement the door-to-door canvassing efforts that I previously mentioned in the 20 hardest hit communities, which is well underway. We've made a lot of progress to get our population vaccinated. I think most people know that this is a big part of getting back to normal, and we'll continue to stay focused on providing access to everyone who wants to get a vaccine. And I've said before that even if we don't see much change in the federal supply, we expect that everybody who wants a vaccine will get one, certainly by the end of June. My hope and my anticipation is that we see some improvements in supply, and that particular date can move up by a few weeks. We know we are in a race against time on this one to make sure we get people vaccinated. We continue to deal with new variants that are associated with COVID-19, but I would point out that every day I'm looking at some of the national scoreboards and I'm tracking case counts and hospitalization rates down the East Coast all the way to Florida and across the Midwest all the way to Minnesota. In Massachusetts, while we do have a higher case count than many of those other states, that's in large part because we test more, and our hospitalization rate is actually the lowest of all the states running from here all the way down to Florida and across the Midwest, all the way to Minnesota, which says a lot of the work that people are doing to identify new cases and help people stay isolated and supported are working.